Hello, I'm Emeritus, and welcome to the CRAM podcast. This is something you might thought was true, but you're not quite sure. And it could be based on what you hear in the news, maybe what you've seen in your neighborhood, and what you hear anecdotally. You're wondering whether violent crime has been on the rise. Well, has it? According to Statistics Canada, it has increased by about 50% in the last decade. Since 2014, there has been an upward trend in violent crime. And a new report that compares the rate of police-reported violent crime in Canada and the U.S. says the gap has narrowed between the two countries. The narrowing is a result of decreases in violent crime in the U.S. and increases in Canada over the last 25 years. So what's going on and what should we be doing about it? Irvin Waller has spent his career studying and speaking on how to reduce violent crime. He's consulted with international agencies, including the United Nations and governments around the world. He's an emeritus professor in criminology at the University of Ottawa and the author of a number of books, including Science and Secrets of Ending Violent Crime. And he joins us. Hi, Irvin. Thanks for coming on our podcast.
Hi, Mary.
So tell us, why has violent crime increased here in Canada in the last decade?
I don't have a simple answer to that. There are a number of things that have probably contributed to that rise. These could be things like homelessness and relative poverty and mental illness and drug addiction and changes in the demographics. But we can never really identify precisely what's been happening to increase it. What we do know, as you said, is that it has been increasing more in Canada than in the United States, although homicide rates are still much, much higher in the United States than in Canada. And we also know that little has been done that really reduces it.
Just before we get into what we should be doing about violent crime, I just want to give some more context about, what we know about who's committing violent crime in Canada.
So we know quite a bit about, from homicide statistics, about both the victims and offenders. And these are primarily young males, between 15 and 30, 15 and 25. And we know that they are disproportionately Indigenous and Black. So if you compare the homicide rate for Indigenous young male men, either as offenders or as victims, it's 6 times that for the average, which are basically white males. But blacks,
let me just stop you for a sec. Can I just emphasize that? Did you say offenders and victims, both?
That's correct. And that ratio is true for both victims and offenders.
Right. Okay.
For blacks, it's about 5. But blacks are not distributed evenly across Canada. They are disproportionately in Toronto and to a lesser extent in Montreal and Halifax. But the rates are very definitely much higher.
Mm-hmm. So young men, young racialized men, and particularly Indigenous and Black men, you're saying?
That's correct.
Yeah. So when you say that, I'm also wondering about, are these young men involved in gangs? Are they acting alone? Are they part of organized crime? Like, what do we know about that?
So in the last 10 years, and while violent crime has been going up and homicide has been going up in Canada, What we do know is the proportion that are committed with a gun has increased, and this is particularly handguns, although in the last couple of years, long guns have become a little bit more important, but they're primarily handguns. These handguns come primarily from the United States. And the other categories are sort of less clear, but the group that are involved in those handguns are rivals, and to some extent rivals in selling drugs. It depends what you mean by organized crime. Most of these homicides are young men who might be part of a network, but they would not really be part of what you would call organized crime. They're not part of the Hells Angels or a cartel in Mexico that is distributing drugs in Canada.
You say in your book that the evidence on how to cut down on violent crime, that's been available. It's been proven for decades. There's a lot of research on it, yet it's not being implemented. Why is that?
Well, I think the first thing is just to reemphasize the first part of your question. Over the last 20 to 30 years, we have got a lot more proven information about what stops crime and what stops violent crime. And these come from random controlled trials. So often quite small. And if you go back to a very famous experiment called the Perry Preschool in Detroit, or a suburb of Detroit, they basically took 50 kids out of 100 kids. And for the 50 kids, they gave them more intensive parenting or quasi-parenting in a preschool program. And they helped those parents too. And then they compared them with the other 50. And then you see a very significant reduction in the ones from the treatment group as they grew up in terms of getting arrested. And you see a cost benefit of roughly $7 for every dollar invested, although today you can up that figure to anything from 15 to 20. These are very cost-effective ways of reducing arrests and crime. So that sort of idea applies to programs that are called life skills in schools. Quasi-experimental design that was used to test those community violence interveners, and then programs that in schools that change male behavior in relation to sexual assaults, and then similar programs in universities. So random controlled trials are very powerful. And many of these were made available on a website of the U.S. government called Crime Solutions. And then they're made available through the World Health Organization, to a lesser extent on a crime prevention inventory in Canada. And I brought these together in one place with the idea that I would explain them to decision makers. If you were a city councillor in Vancouver or Toronto, or even you were somebody working for the city of Vancouver or Toronto, you would find it difficult to access these, to understand them, and to see how you could apply them. So the second section of my book was meant to explain these in relatively simple terms that somebody could understand who was advising a minister or advising a city councillor to help them be put into action.
Sorry, so let me just understand this. So you're saying it's cost effective. It's been shown to work, these programs, but they're difficult to implement.
No, they're difficult to understand.
So doesn't that make it partly difficult to implement because you have to?
You're absolutely right, but you have to go to the first base of understanding them. Mm-hmm. And in the second section of my book, the third section of my book, I talk about how you actually apply them. And people overlook this, and it's one of the main reasons why in Canada we don't see these very effective, very cost-effective programs applied.
So what you're talking about, I think from what I understand, you're talking about social and educational programs. Is that right? As opposed to, I guess, what we often hear about, more policing and stricter incarceration.
The clearest thing that we know today is that spending more on police does not reduce crime. And punishing more severely does not reduce crime, except that during the time that the offender is behind bars, you get what's called an incapacitation effect. So during that time, they're not committing offenses. But these are very expensive solutions to taxpayers. And when you try to increase the use of them, they are expensive because the harm done to victims of violence are major. If you look just at the direct injury and hospital care, the two, both the harm to the victim and the costs in hospital care, that's one level. But once you realize that there is trauma, and people talk about PTSD today, but it's not really well understood by the general public. But trauma is a really key thing when you're talking about violent crime. So if you look at the impact of a sexual assault on a 15-year-old girl, you see the immediate consequences. What you don't realize is that when that girl hits 40 to 50, she starts getting a number of health consequences that can't be cured by a surgeon or by a pill. So the long-term consequences, and it's not just of sexual assault, it's perhaps more obvious to folk like me in sexual assault, but this is also true of a robbery or a family member of somebody who's been murdered.
Yeah, it's interesting you bring that up because I've talked to a number of medical and health researchers who have pointed that out, who've talked about treating adults who are, now middle-aged, but that part of the therapy needs to be a psychosocial component because of trauma that they've experienced in their past.
That is sadly true. There are, in these random controlled trials, there have been some trauma therapies that have had an impact, but they're relatively new. Whereas you referred to schools, so a life skills program in a school or a program basically teaching boys to understand what is meant by consent and what to do with their sex drives in simple terms. Those are well established and with very significant payoffs in terms of the reductions and in terms of the reduction in payments for costs later on.
Yeah, I want to go into that in a little more detail, but let me just go back to also the whole policing incarceration argument. You say that that has not been shown to work. How do we know that? What is the evidence to show that doesn't work?
Well, there's a lot of research basically done in the United States and the United Kingdom looking at this. And typically what they're doing is looking at trends over time. To make it simple, I use the example of comparing Toronto and Chicago, two relatively prosperous cities, both around 3 million people. Toronto has 70 to 80 homicides a year. Chicago has 600 to 700 a year. If you look at the policing levels in Toronto, it's roughly 5,000, 6,000 sworn officers. In Chicago, it's 13,000, so more than double. If you look at the use of incarceration in Canada or in Ontario, you're talking about 100 per 100,000. In Illinois, you're talking about 500 to 600 per 100,000. So clearly, having more police officers and having more people incarcerated is not enough to give you less violence.
Sorry, can I just ask? Is that actually is that a fair comparison? Would there be other factors that have to be accounted for? I don't know whether it's housing, homelessness, jobs, cultural differences. What about all those other factors? Do we need to account for those too?
Well, I didn't say that more police and more prisons caused more violence in Chicago. What I said is that more police and more prisons are not enough to reduce it back to the levels in Toronto. Yes, you're correct that there are other differences, and those other differences have to do with concentrated neighborhoods of poverty associated with racial concentrations. It's easier to access handguns in Chicago because you can get them from Indiana, whereas it has to come across the U.S. border for them to be available. So there certainly are other contributing factors.
So you've studied communities around the world and what strategies they've implemented to reduce violent crime. Where can you point to that's been a success that we can learn from here?
Well, I want to go back to Bogota because it's in my book. Bogota in the early 90s had a mayor who wanted to reduce violent crime. He brought in a public health analysis group. They looked at where the violent crime was occurring and what were the correlates like using guns, alcohol, and revenge killings. So I shoot you, so you come back and shoot me. And so they implemented a program on each of those three. They tried to buy back the guns from the young men. They stopped sale of alcohol on Thursday, Friday, and Saturday nights because a lot of these shootings are very emotional. They're not planned. So and also when guns are used in domestic violence, it's very much at the last minute. So they made access to alcohol difficult. Then they had outreach workers in the hospital emergency rooms to stop them going back on venge killings. So that's what they did. And it took them 10 years to get a 50% reduction. And then in the early 2000s, I was actually at a meeting where we were talking about the Bogota model, and there was a top cop from Glasgow who was there. And you heard him say, in the back of the room. And he went back to Glasgow, hired a woman with a public health master's degree, and he got her to diagnose the problems in Glasgow. And the two of them then set out doing the things that they felt would reduce violence. So one of those was community outreach, which had been tested in the UK and was very successful. They also did some stuff in hospitals. And within 3 years of starting the program, took them a couple of years to get going, but within 3 years of starting the program, they got a 50% reduction. And people have been looking at Glasgow to say, well, what happened there? How can we replicate it? And the Brits were a little bit slow in multiplying it across the country, nothing like as slow as we are. And they then, there was a commission that recommended this. The mayor of London decided to go for tough on crime, tough on causes. And the way he implemented tough on causes was to set up a violence reduction unit. That was the name used in Glasgow for the planning group. And it was chaired by a top councillor. And they basically have been analyzing where they need to have outreach programs for youth, and they've been putting money into that. And they've been getting reductions. There are a few areas where they've been getting a 50% reduction, but across the city, they're getting a 25% reduction in fewer people going to emergency rooms, and that's an indicator I really like, and about 25% in police-recorded knife crime.
So can I ask you, was this all based on the original model, like that was in Bogota? Were there components? So what I'm wondering is there something universal that you can take from that and then you customize it and you apply it to your own community?
Absolutely. So in the third section of my book, I look at the UN guidelines, and I look at guidelines from UN Habitat. That's the city agency of the UN. And they set up a safer cities strategy that I was involved in developing. And it uses all of the things that I mentioned. And it recommends a planning secretariat. You call it a violence reduction unit or a community safety planning group or the Safer Cities planning group. It's very much the same as happened in Bogota or Glasgow, or for that matter, more recently in Boston. And then that planning group does the diagnosis, does the business plan, gets the city council to fund it and invest in it, and then you monitor it, you evaluate it, and you try and improve it. And the UN Habitat guidelines are similar to the UN Office on Drugs and Crime. They have two guidelines that are pretty similar. So, yes, you need a planning group. You need them to do the planning. I think in my book, I've learned some other things that go beyond those two things. And that is that you have to involve people from those communities. Mothers are particularly concerned about any sort of violence to their kids. So you need to involve them. you also need to get to know this knowledge about what works, so that you know what to be looking at. So they need to know about those, and they need to know what the costs are. And as I've done in the fourth section of the book, they need to be able to argue the very compelling case for these investments, and they need to know how to get allies. And it's easier to see this at a city level, but what we need at a city level, we need at a provincial level, and we need at a federal level. Canada had the beginnings of a national crime prevention strategy and a national crime prevention center, but it never had the skills that were needed. It never really developed a plan along the lines that I've said. It wasn't able to get sustained funding. So the last 10 years have really been a very big missed opportunity to do the things that will stop the harm to victims and save the losses, the health losses, the financial losses, and also save money at the local level. In Canada, roughly 2/3 of policing is paid for out of municipal taxes. And in many cities like Winnipeg, you really notice when a big proportion of your municipal taxes is going to policing. Mm-hmm. What you don't know is that there are ways to avoid the violence that the police use to justify their increased salaries and their increased budgets.
But isn't it easier to hire more police? That's a visible sign that you're doing something, right? You hire more police, you've got more police, maybe you put them on the streets. Whereas what you're proposing, even though there's evidence to back it, it's very like it's this multi-pronged approach that has, different areas. You need to convince different groups of people to buy in. There's training involved. Like it's more complex. It works on so many different levels, and it takes time. It's not like it's an immediate, well, we're going to hire more people, more police, and we see that. Do you know what I mean? Isn't that part of the problem?
So in Canada, we like our police, or most of us do. Our national symbol is a Mountie. So we're in a worse situation than some other countries because it's a good thing to invest in police.
But isn't it good to like our police too?
Well,
what would happen if we didn't like our police at all?
So we're spending $20 billion on policing.
That's a different story. Yeah.
You can like them when you're spending $20 billion, or you can like them when we're spending $15 billion, and we've got a lot less violence, a lot less street violence, a lot less school violence, a lot less violence against women. We have an epidemic of violence against women that many municipalities have declared. We know that there's a lot more student-on-student violence in schools and student-on-teachers. And we know that the violent crime rate has gone up. Yes, there is a challenge here, but if you care enough about the rates of victimization, then you need to make these changes. And in my fourth section, when I talk about the secrets of making those changes, one of them is to ally with victims. The mother of a teenager murdered on a TTC platform, the first thing she said the next day was, we need to attack the health determinants that led to this violence. We don't need more police. We don't need more judges. We don't need more prisons. And she's not alone. I know there are others that basically want to throw away the key whether the person is actually guilty or not guilty. But I think it's important to work with those victim groups. It's also important to develop these social planners. You know, we train lawyers. I'm not sure exactly how you count the number of years. They have an undergraduate degree in 3 or 4 years, and then you have 3 or 4 years in a law school. It takes a long time to train a lawyer. And the police officers in most provinces, they have to have a university degree, and then they have to go through training in a police college. It doesn't happen overnight. And when you're talking corrections, it's somewhat similar. All of these things, we need to train people. So I don't think it's too much to ask to train the people who can do the social planning. The US, since the book was written, has reduced homicides across the country. As you said at the beginning, their homicide rates are coming down. Well, they're coming down because the US invested in community violence interveners and in cognitive behavioral programs. So there was money there. And they already had some people who could do the training. I think the planning, if we want to leap forward and reduce our homicide rate to something like the UK, which we can do even with lots of handguns on the other side of the border, we need to invest in those planners. And England is now doing these violence reduction units across the country. They're evaluating them. I think they could do better, but hey, they're doing way better than us. But we can learn to do it. We can build on their shoulders.
So, yeah, actually, I'm just going to pick up on something you quickly mentioned. The fact that most of the guns that are involved in crime, certainly in Toronto, because I've heard the Toronto statistic, I think it was about 90% of guns were involved in crime here, could be traced back to the U.S. How much of an impact does that have? Is that a factor in the prevention of violent crime?
Yeah, well, handguns are what have been used in Canada to.
Yeah,
it's clearly
so the fact that they're more accessible.
Yeah. To it's clear that the arrival of more handguns has led to more homicides. I'm not against trying to do more at the border. I just know that it is so easy to get around whatever you do at the border, particularly one that is as porous as ours, while the programs that are outreach to these young men, the programs that help them think twice before they go out and shoot at somebody and kill a small kid in an apartment building, those we know work. If we actually invested as much in these programs that work and the skills to get them to be implemented as we are spending on trying to stop them come across the border, we would see big reductions. I think we can see a 50% reduction in violent crime within the next 5 years if we actually develop those people with the skills, if we actually get both the provinces and the federal government to invest in the programs that we know work, like the US has been doing and the UK is doing.
So then can you give me a scenario for, I don't know if it's Canada or whether you have to actually scale that down and it's a scenario for a city, let's say like Toronto, but if you were to say these are the top, I don't know, three or four evidence-based practices that you need to implement for the next 5 years to reduce violent crime, like what would you be? If you had the ear of Mark Carney, right? Or Olivia Chow, the Toronto mayor, like what would you say, this is what you need to do?
I would start with make sure you've got the planning expertise to plan where you're going to put these and identify. But on the shopping list for implementation, I would have outreach to young men. I think in Canada, we should be using social workers, street social workers. The second one would be SNAP, Stop Now and Plan, which basically helps young men think twice before they react on their anger or emotion. And
Is that a Canadian program?
It's a Canadian program developed in Toronto, evaluated. It's on resource sites in other countries. I'm not sure exactly how many there are in Canada, but we need way more of them. A third thing would be emergency navigators. In Toronto, there's a program called Thrive in St. Michael's, which is basically one of these street workers, but when somebody's been shot or stabbed, you work with them to get them out of the situation where they're likely to get shot or stabbed again, or shoot or stab somebody else. And I would also put stuff in schools. Life skills is one of the best established programs, but I would combine it with programs basically about how to avoid gender-based violence, consent and respect, and those things. If you start when they're teenagers, this goes on as they get into life, whether it's in universities or elsewhere, or into relationships. So those would be. And I would also have a earlier program. So to some extent, the childcare policy, the national policy goes there, but you really have to have it more intense where the mother is in difficulty and where she's likely not to be able to give consistent, caring parenting.
Even when you implement these strategies, do they butt up against other negative factors like difficulty with housing, inflation, mental illness, rising mental illness, job loss, and the situation we're in right now in Canada? Is it difficult when we have those other issues at play as well?
If you provide housing, you can help people with drug problems, with job problems, with some mental illness. So that would also be on my list.
What sense do you get that any of this is going to be taken up here in Canada?
Well, I think if you look at the Carney government and you look at the opposition, what you see is a battle as to who is going to be the toughest on violent offenders, whether they're going to be released on bail or not. But you also see some interest in police on the border, mainly because Trump wants it, to stop stuff coming from Canada to the US. I don't really believe that it's a major problem, but if we can stop their fentanyl people and their handguns, it's okay, even if it's not perfect. Yes, so when we're looking at announcements by Carney, we see some reference to tackling things like homelessness, universal daycare, I think there's some talk about better mental health services. So some of the longer term causes may be addressed, but they will take time. I see some appetite to do short-term projects. That's what they've been doing for the last 10 years. And many of these projects have been successful. But you can't reduce the overall violent crime rate by $1 million in a neighborhood in Toronto and $1 million in Edmonton, or even 50 of those. You need to have a plan in the city to make it happen. Ontario actually has legislation. So in 2019, they changed the Police Act to be called a Community Safety and Police Act. And Section 251 in that Police Act, it replicates many of the things I've been saying to you today. It says identify the crime or the victimization problem that you want to solve. Identify the risk factors, not the long-term causes, the risk factors contributing to that problem. Identify what you're going to do about it. Implement it and monitor the results. What it misses is that you need to have the skills to do that. And so if we actually had the skills, we would see in Toronto, we certainly have a commitment by Mayor Chow to do some of these things. They have Safe Toronto. They put a little bit of money into it, but they also need the skills to develop the plan and to get enough money to make the sort of differences that you see in Boston, or by the way, we're beginning to see in Philadelphia and a number of other U.S. cities. Even Chicago has managed to bring its violent crime rate down a bit. In the inquiry into Renfrew near Ottawa, where a guy killed 3 of his ex-girlfriends in one day, there was an inquiry, and with recommendations, and they have an event to look at those recommendations. Well, amongst those recommendations is let's get upstream. Yes, we've got to make sure that the probation service works better and the police work better in reaction to try and catch the guy before he does more. But we need to stop producing people who are potentially violent like that.
All right. We'll end off on that. Thank you so much. I really enjoyed our conversation, Irvin. Thank you so much.
Okay. Good luck.
That's Irvin Waller. He is an emeritus professor in criminology at the University of Ottawa. He's the author of a number of books, including Science and Secrets of Ending Violent Crime and Rights for Victims of Crime. If you'd like to know more about Irvin's work and books, you can check out our show notes. That is it for the show today. If you enjoy our podcasts, we'd be thrilled if you made a donation to CRAM. We're a charity, and we would be grateful for your support. You can head over to cramideas.com. Thanks for listening, and see you back here next time.